and I've got a hat on me mind right now.
That's exactly what I was looking for. Thank you. Natasha. Hi.
I love you guys, but I'm not caffeinated enough to follow that, Scott.
All right, that's all right. I understand.
Totally okay.
I'll wake up the therapy dog. I'll show her off, but hi everybody. I'm Natasha. I am with Lake Nona Behavioral Health Services. We are a private practice, currently still telehealth. There are 3 psychiatrists on staff and then myself as the LMHC. I am planning on returning back to office probably within the next couple of weeks. I need to just do it. I've had a couple of my families bothering me about when I'm going to be back in person. But I think that when we do return, we're each going to choose like one day when we're back in office so that we're not like on top of each other. So yeah, we're continuing to see people. We see children, adolescents, and adults. And in exciting news, all right, I'm going to wake her up. Somebody did her first official outing yesterday.
Celeste, we're so proud of you.
We went to Orange County Academy and she was a big hit and she did so good and I wanted to cry. So
and then
wait, the cat is like, what about me and my chopped liver?
Oh.
What? Hello.
Aurora likes to crash my sessions and yell at my clients. I'm not sure how entirely therapeutic it is.
I love Aurora. I feel very therapeutic around her.
So, here, I'll show you. Okay, this one doesn't have any faces. So there she was meeting kiddos.
Oh, that's awesome.
So yeah, that's exciting.
I love it. Go Celeste. So exciting.
Oh, Molly from Canopy Cove.
I don't know what accent to do because literally I just have a Southern accent that I cover every day, and now it feels
don't
weird.
cover it up. Let it come out.
It feels weird to talk with it. Like it slips out sometimes, especially when I say yella. I've literally worked for years to get rid of this thing because everybody told me it made me sound ignorant. That's fun. And also nobody thinks you can have a Southern accent in Florida. That's weird talking. So I'm from Canopy Cove. This sounds really weird. I can't keep it up. I'm from Canopy Cove. I'm here in Tallahassee, Florida. We still have our residential PHP and IOP programs going. Our IOP in Jacksonville is up and running. No real changes or anything. Thank you, Lisa. But yeah, so we're just good to go. I'm still meeting with people, so definitely I'm very excited to hear about the topic today because sometimes we do have clients who come in with that and need aftercare.
Your accent makes me feel warm and fuzzy, so.
It's the Southern Belle thing.
Oh, who's next? Sarah Summy.
I had to unmute. My Southern accent's just always there, so.
And we love it.
My name is Sarah Summy. I'm with Palm Point Behavioral Health. We are, for those of you who don't know, I see a few new faces, inpatient psychiatric hospital on the Space Coast in Titusville. So we treat 5 and up. Just opened our our specialized senior unit for adults 64 and older. So we're really excited that. I would love to offer anyone a virtual tour who wants one. We also have our 2-year anniversary celebration coming up, and that will be a safe, socially distanced drive-through event. So I will put all the info for that on the Google Doc. And Wendy mentioned the food drive. That's actually a friendly contest between all of us. So you should call me instead of her. I'm just kidding. Call us.
And Kelly's in it too. So you guys listen, all of our CEOs will be the team who has the least amount of canned goods has to have their CEO wear a big turkey hat. So yeah, it's a big deal.
I feel like they should wear it if they win. I don't understand.
So good. Put this embarrassing hat on.
Yeah, I don't know. Oh, Susan.
Hi, everyone. I probably won't be doing an accent because I failed acting class, so I don't think you're going to get anything out of me. I'm Susan from Agape Therapy Institute. We're downtown Orlando, outpatient mental health. We're a nonprofit, so we offer sliding scale options, and we're in network with some insurances. Yeah, we're working mostly telehealth right now, but if clinically necessary, we will go in the office. Just kind of depends on the case, and it depends on the therapist too. Some of them have some health problems, so they're not, going to take that risk. Others feel a little more comfortable. And right now we are still kind of looking for small donations as well, just to keep our financial assistance program going for people who have lost their jobs and insurance benefits due to COVID. So small donations for us that actually go a long way are like $25 donations. So if anybody has $25 to spare to help someone get a counseling session,
Where
reach out.
would they donate? Online?
Yeah, usually they could donate through Facebook on our page there, through our GoFundMe, on our website as well. We have it listed. We're Agape Therapy Institute, so you might have seen us kind of in the groups online. But yeah, small donations go a long way for us because it usually $25 will usually cover one session for one person. And then you'll get a nice little thank you letter from the client without their name on it, of course, to protect their confidentiality. But most of our clients are actually writing kind of some heartfelt thank yous. So that's kind of cool. Yeah.
Do you want to mention family immigration? Or are you holding off until it's?
Yeah, I can talk about that. We're also developing another business underneath Agape called Family Immigration Services. And it's going to be psychological evaluations for immigrants, either the Violence Against Women's Act or political strife, seeking asylum, that sort of thing. So we're developing that business, and that's going to be a sliding scale as well. And probably starting in Central Florida, but generally, or I guess eventually we want to go all around Florida and even into other states as well. And that's brand new. So in the next few months, we're going to start to roll that out and people will hear more about it.
Very exciting.
Thanks.
Thank you. Am I saying this correctly? Redo?
Hi, everybody. You can say Ritu. That's like the Americanized version, and I don't mind that at all. Hi, everyone. I'm new here, actually. Natasha told me about you guys. So thank you, Natasha.
Welcome.
Thank you. I'm actually I'm not going to try the accent because I'm a perfectionist. And I'm from the South, and my brother-in-law's from the UK, and I've heard the real accent, and I just am not going to do it because
Do you think we're all idiots, essentially?
Yeah.
You're like, these people are not, this is wrong.
Oh no, I don't think you're idiots. Like, I was really going to be my Southern because I'm from the South. I have a slight, I don't really have a Southern accent. I say y'all a lot. So. But I used to work at Aspire in community mental health when the pandemic started, but due to just a lot of different factors, I transitioned and I'm doing BetterHelp right now. So actually, I just feel like I've been navigating the pandemic with not a lot of professional support and just kind of transitioning into what I guess would be like private practice. And luckily I've had some, peer support, but I'm really grateful to be talking to you guys because I feel like I've really not had a lot of professional kind of infrastructure.
Yes, we do this bi-weekly because I think we all need that.
Yeah, and I also love that you guys have your animals in here because I've locked by now, but I love
Oh, bring them in. We're professional, but we're also casual.
Cool. All right. It's
All
nice
animals welcome.
It's nice to meet you all.
You too.
Oh, thank you for being here.
Kelly.
Good
Kelly,
morning,
Kelly.
everyone. Good morning. I will talk with my Boston accent since I'm from there. So I park my car in Harvard Yard, but unfortunately I've lost it. So it's kind of hard to keep it up. But good morning. I missed you all. I didn't attend the last one. I'm doing this from my phone, so I'm hoping I have good signal. My computer is down and I should be getting it back this week, thankfully. So I'm with Central Florida Behavioral Hospital. I think you all know we're inpatient. We do partial and IOP. Our newest thing, I got to keep my accent going, is we have an adolescent IOP virtually. So that's just one of our new things. And it's good to see everyone. I always love this on Wednesday mornings and look forward to it. So good morning.
You guys doing any telehealth? For
I'm
IOP?
sorry.
Any telehealth or in person?
Yes, the adolescent one is virtually, it's telehealth. And then the IOP and PHP for adults is both. We have some that come in, but I would say most of our folks are doing it telehealth virtually.
Okay. Good to know.
Thank you.
Thank you. Janet.
Good morning. So this is the real Southern accent because I'm still Southern. Y'all, I actually live and work in Knoxville, Tennessee, but I work for Cumberland Heights, which is a program, drug and alcohol recovery program out of Nashville. So my role in Knoxville is IOP. We are opening 2 locations. We are doing tele and in person. And in Nashville, we have residential starting with adolescents all the way through. We have men's program, women's program. The adolescent program is actually a certified school, so the students can actually continue their education. So, but I'm involved with your all's group because I love to learn. And I've done several of your educational programming and things like that. And I love to learn how to network. So that's why I'm here, and I'm happy to be with you and happy to learn from each of you, and good to meet you and see you.
We love that you're here and you have Tennessee fans.
Yes, in the chat, we've got a couple people. Shout outs to Tennessee.
Pilar. Love the pearls.
Thank you. Good morning, everyone. Pilar Von Lazar with Palm Shores Behavioral Health Center. We're a residential treatment facility for children and adolescents ages 5 to 17. We also have a school on site. We take Medicaid, TRICARE, and most commercial insurances. And average length of stay is about 4 to 6 months. I'm curious as to, and I'm excuse me, I'm sure Kelly and I have had this conversation before, but I'm not sure, I don't recall. What part of Boston are you from? Because I grew up in Winchester, which is just outside of Boston. And what part are you from?
I am from a little town called Rainham, and it's just before Plymouth. So it's right by Cape Cod area. So it's South Shore.
So South Shore, yeah. So I'm from Winchester. My parents didn't grow up in, what?
I didn't know that, I don't think.
Yeah. So my
Wow.
my parents weren't from the Boston area, so I didn't pick up too much of an accent. But the one thing I do still say is, please get me the three pencils out of the top left-hand drawer. It's a drawer. I can't say, like, it's too difficult to say drawer. Like, I can't do that. Drawer. Like, my mouth doesn't even move that way. It's a drawer. It's the
I gotcha.
And it's a dresser, not a bureau. A bureau. I don't know. like my mouth just doesn't move that way.
Oh, Pilar, you were so funny.
Right?
I know, I love it.
It's a bubbler. It's a bubbler.
It is a bubbler.
Water out the
It's a bubbler. And so, and you know, we have a cellar, not a basement, and we call it, I mean, there's certain words that I still say, but the drawer, I can't not.
It reminds me of how do you like them apples? What movie is that?
Yeah, that's Good Will Hunting.
Yes.
Yeah. How do you like them apples? Like I had an old boyfriend that used to say that. And I said, oh, here's one other thing. Had a boyfriend, we're talking about accents, when I was growing up, and he called me Pila. Pila. It's like, that's not even my name. It's not even close. My name's Pilar or Pilar or, you know, Pilar or Pilar or something like that. Like there I can say, yeah, Pila, this is Pila. I'm like, my name's not Pila.
And then you broke up with him.
Over.
Yeah, pretty much. When he grew facial hair too. I wasn't into that. No offense against facial hair, men. So Scott, no offense, you look good with it.
None taken.
I was in my
So much.
20s. So yeah.
Doug, tell us about yourself. Who are you? Doug Paul.
Sorry, I missed that. Hey guys, I'm Doug. Had a cool open house yesterday. Saw Sarah there. I don't know if anybody else on here we saw there. Scott, thank you, Scott. Thank you. Thank you guys for coming. So I'm working with Retreat Behavioral Health, and they're opening a brand new office in Orlando, doing IOP and mental health. It'll be primary for both, so like 2 different tracks. And we'll be open in probably a few weeks. Also still doing the private practice. Most, if not all of my clients are still in Atlanta because I'm licensed in both states still. You know, I thought that I was from the South before I moved to Atlanta. And I was like, wow, you actually have to go north to go south once you grew up in Florida. And there's some strong accents up there. There's also like the frat boy uniform and the sorority girl uniform, you know, the oversized t-shirts for the sorority girls, the really short shorts, and the frat boys have the University of Georgia baseball hat, and it's all curved at the front, and it's complete. It's like they washed it 4,000 times before they actually wore it the first time. It's so shredded.
It's not a good look.
It's the uniform though over there in Athens. Anyway, I won't try an accent this morning.
I'm excited for you and your position and that opening, so keep us posted.
Oh well.
Marty Ward.
Hello, bonjour everyone. Comment allez-vous? This is Marty.
Oh, oui, bien sûr.
So delightful to see you all this morning. All right, enough of that. So what I'm excited to tell you is that Confidence Build Success Academy I'm the founder of, it has received a grant, and we are going to be offering free training to educators in Brevard. We're looking for high school and college educators to fulfill the grant so that we have 40 individual people who take 1 hour of the course. It's a 4-hour course, but you can just take 1 hour. And but any educator can do it for free, and it just doesn't count towards my grant achieving. But what it is, it's Care Maximize Your Performance training, and it's social emotional intelligence, understanding yourself, because people obviously are going through this COVID time and trying to teach online and in the classroom and get kids to show up and do their homework. And oh my goodness, right? And it's just like everyone is just struggling so much. And on the news this morning, they were talking about 2 out of 3 people have increased stress since COVID. I'm sure some of you have experienced this with suicide. Half of all 11 to 17-year-olds are thinking about suicide often. And then hundreds of thousands of people have called for mental health. So, you know, you all are doing such wonderful work, but I want to help the teachers to be able to, you know, have more of themselves available so that they can really be there for the students, and also help the students to be there for themselves, because we have a lot of kids who aren't doing well, and the teachers are just like, you know, trying to manage so much. And I just want to give them extra skills. So I'd love any help with that. If you know teachers, educators, I put something in the Google Doc. I couldn't find my name, so I put my name again on the bottom. I tried. Anyway, put me back on the bottom. If you can send out the link, I would deeply, deeply appreciate it, because I have to, you know, I'm sure we'll get 40, but I'd appreciate any help.
Hey, Marty, it's
Yeah.
Lisa from Brevard Public Schools. How are you?
Oh, hey.
So
Yay.
I don't know if you've made the connection with Kathleen Erdman.
I'm sorry, I can't see you or hear you because you're.
You see me? Yeah, it's my office. It's a computer thing. There's people walk in and out of the door. So,
Oh,
so can you hear me?
I can hear you. You're Lisa, yes?
Yeah. Okay. So Kathleen Erdman started with Brevard Public Schools this year. She oversees SEL.
Erdman.
The
Can you put it in the chat?
Uh-huh.
Kathy Erdman, and she oversees mental health?
SEL.
SEL, okay. I'm sorry, I'm having trouble hearing you. Okay, if you
Perfect.
just put it in the chat, that would be fabulous.
Okay. And then if you want to email me, like if I'll put my email.
Yeah, I have a press release that I can send you and some information. I'd so deeply, deeply appreciate it. That would be great. I just want to help the teachers because.
No, I've sat through one of your trainings before, and I'm just so thrilled with everything you do. You complimented everybody else, but you're amazing.
Oh, thank you so much.
I love that. We have a couple minutes. Does anyone else want to introduce themselves? I know Matthew's on, Lindsay's on, and then Savannah.
I'll introduce myself. So I'm Lisa Elam. I've been on your meetings a couple of times. I was born and raised in Brevard County, went to school here, moved away to, and my accent would be parlez-vous français to Marty. I moved to Delaware and Maryland area. I went to University of Maryland. I have a master's degree in community counseling and school counseling. Been a school counselor and a mental health counselor for 20 something years. I work at district with Brevard Public Schools, overseeing bully prevention, substance use prevention, violence prevention, LGBTQ contact, and child trafficking, also mental health. We have mandated lessons for substance use and abuse and mental health and child trafficking that we are introducing to the schools. Today happens to be Unity Day. I don't know if you see my shirt. It's Unity Day to promote bully prevention and awareness too.
Yay.
All right.
Thank you. Thanks for being here.
Hey everyone, I'm Lindsay. Oh, sorry, Lisa.
You're perfect.
Okay. Hey everyone, it's Lindsay. Sorry my video is not on today. I'm working on a few different things, but I still always love listening into the conversations. I just want to let you all know our most recent update is that we now offer evening IOP. Besides that, we treat adults, adolescents for addiction, mental health, and eating disorders. So if you need anything, my information is on the sheet. So I'd be happy to help.
Thanks, Lindsay. All right. Anyone else? Last
Hey,
chance.
I'm Matthew. Hi.
Hi.
Why you laugh, Sarah?
I'm excited to hear you.
Oh my God, I'm so sick. I have no business turning on my camera, so forgive me. But it's not COVID. I got the test. So I'm Matthew with St. John's Recovery Place. I just wanted to throw out there that I just went out to our facility. Our detox and residential location is in Crescent City. And I just went out there yesterday and we've got our new 5,000 square foot outpatient clinical office is getting furnished today. So within the next, I would say 2 weeks, we're going to be offering PHP and IOP in our DeLand location, which I'm really, really excited about. So I just wanted to throw that out there. We are currently also doing PHP and IOP down in Cocoa Beach. So I'm excited that we're offering all levels of care now. Most of those in-network, our detox and res is in network with just about everybody you could imagine. Scott, I sent you a couple, I gave your name to a couple people yesterday, so you should have heard from some folks.
Yeah, we did. We're going to talk right after this call.
Okay, good. But a lot of those in-network contracts are now rolling over to also cover the PHP and IOP levels of care, which is a process in itself. If you guys have ever added additional levels of care, every one of those in-network contracts has to be like amended or whatever. So it's been a process, but we're slowly adding all of those to the PHP and IOPs. So I'm really excited. 3 locations now. I mean, when I started 18 months ago, we had the 1 location and we were in network with like 4 insurance companies. And now the list is very extensive and we've got 3 locations. So really excited. If anybody, oh, I guess I could put my info in the, oh, I'm on the spreadsheet, I think, the Google Doc. If anybody wants to set up a private Zoom, not private, that sounds weird. An individual Zoom. Yeah, if anybody wants to cam with me, no. Just kidding. So yeah, that's the latest. Sorry I was late, you guys. We had a team Zoom this morning that went long.
No worries.
Ah.
Happy you're here.
Feel
Sorry.
better.
Good to see you, Sarah.
Good to see you. All right, let's talk. Let's talk about this. Oh, wait. Savannah is introducing herself. She's in the chat. She works with Aspire. Thanks for joining us.
Yes, thank you.
Let's dive
All right,
in.
y'all. So we're going to talk a little bit about personality disorders this morning. And I know just to start us off, personality disorders can be really to treat. And we want to just kind of talk about what are you using, what are you seeing? And we have a couple of questions to kick off our talk. And our first one is, how can you tell if someone has a personality disorder if they're coming into your office?
And how quickly do you
Well, I guess
diagnose
the first
them?
way would be if they tell you. Yes, yes. Like, are you seeing anything that you're picking up on where you're like, I'm wondering, could this be possibly a personality disorder?
Maybe potential egocentric behaviors.
Lisa says relationships, like chaotic relationships. Difficulty with.
Yeah.
Would you say someone who blames everyone else for everything? Any of their problems never is their fault,
Yes.
everyone else's. And
True, true. So maybe some of those patterns that you see from session to session, and it's more of, something that you start to see as your session goes on. Mhm.
I don't know if I'm going to say this right, but like drastic mood changes, maybe like within, as you're speaking to them, because I used to have people that had borderline personality disorder, and obviously it manifests in different ways, but I had a particular client that literally like 1 minute could be like praising me, and then the next minute could be like, I'm the worst person in the world. So I know that isn't always how it shows up, but maybe if you see something like that.
Yeah, for sure, for sure. Yeah, or if you can't, like, when you're having trouble putting the story, everything all together, you're like, something just isn't quite right.
For me, I'm usually noticing that there's like an overabundance of defense mechanisms in place. There's a lot of resistance. There's a lot of defenses going on. That's sort of how I can tell that there might be a personality disorder, or, a lot of traits of a personality disorder. And I tend to also, I won't really diagnose it unless it's extremely obvious, and it would actually help the client to be educated and sort of own that condition. But in a lot of clients, I think it's even helpful just to kind of understand their attachment style, and that can vary depending on the different personality disorders. And it helps in treatment quite a bit. So yeah, that's sort of how I approach it.
Okay, aside
Love
from
that. I
borderline,
like
Wendy, go ahead.
Oh, I was just gonna say, thinking about and being mindful of whether or not a diagnosis is truly going to help someone or hinder someone. It's so important, I feel, to keep people from identifying themselves only as a label. So, you give someone a label as borderline personality. What does that mean? Does that mean you can still have a successful life? Does that mean, that I think that's really important to look at.
I think about all the stigma that's attached to it as well. I know, I mean, I'm not a clinician, but being around them as much as I am, I know the borderline client is typically a very difficult client, and usually you get the like cringes and things like that. And I'm wondering how we, I don't know, navigate that, because I have compassion that it's a difficult case. At the same time, if I were that client and I knew that that the whole treatment team is like, cringing, like this is an issue, I don't know what are ways that we can like combat the stigma around that?
I think you definitely have a point there, Sarah. It seems like, especially for centers that are not primary mental health, hearing any kind of personality disorder diagnosis or dissociative disorder diagnosis is like a huge red flag. And I think advocating for that individual to get care can be difficult if you're not a primary mental health center.
And we see it so often with eating disorders.
Absolutely.
Yeah, I think it's pretty, at least within Agape, our clinical team, it's pretty destigmatized. I really push, not that well known of a theory, but it's the Masterson approach. And rather than referring to it as personality disorders, he refers to it as disorders of self-development. So he's looking at it from an attachment-based perspective and sort of their concept of their own identity and how that's developing, and it's impacted by relational trauma, other kinds of trauma. So when we talk to the clients about it, we often are not using the word itself, schizoid, narcissistic, borderline. We're actually just explaining the concept of their attachment to them. And most of them feel extremely validated when they hear the conceptualization and they identify with that and it makes sense to them. And that facilitates the healing process. Like very rarely are we actually saying, your attachment style and the trauma that developed is actually more like schizoid. Most people would be really freaked out if they heard that word, or borderline. And one thing that I learned, how I ended up kind of being exposed to the Masterson approach, was I had a client who I was convinced had borderline personality disorder, but I was very stuck with her. So I ended up seeking consultation from a woman in Winter Park who specializes in the Masterson approach. And she's the one who actually explained to me that there are a lot of people who have a more schizoid attachment style and a more schizoid development that then have borderline defenses and narcissistic defenses as protective mechanisms. So many people are kind of misunderstood as appearing to be more borderline or appearing to be more narcissistic, when really what's happening is a little bit more of that schizoid type of attachment.
Yeah, I like the approach, what Susan pointed out too, because I think, I worked in direct care. That's where I got my start as a tech. And they used to talk to us about the younger females, and sometimes they would jokingly refer to them as baby borderlines. And although you cannot really be diagnosed necessarily at that age, focusing on the attachment and focusing on what, the attachment issues were, rather than and I think Wendy, you pointed out, rather than labeling the person the diagnosis, it's explaining to them what's happening with them and then giving them coping skills. The ones that were always fun too were the histrionic ones. And I said, well, they make great actresses. We have to, teach them to use their powers for good and not evil. I mean, I jokingly say that, but again, to that point, teaching them not their diagnosis, but going back through that history, that attachment, and then giving them coping skills moving forward, because I think, like you said, they find that more helpful rather than going, okay, I've got this diagnosis, now where do I go with it? If that makes sense.
Right. Yeah, it does. It's the whole person. You're not just one thing.
I think the trauma piece is huge too. And so that's one of the things I always try to make sure I cover in my intake, because I don't know, I'm, I guess since I do a lot of trauma work, I'm my antenna are kind of always searching out trauma. And so I think that I don't know, I guess I kind of look at it from a trauma perspective. And then because I try to do strengths-based stuff from the trauma perspective, it's like, you know, look how far you've been able to come, even though you've had all of these other challenges. And, you know, you can build upon that progress. And I think coming at it from a strengths-based thing sometimes helps too, because they're not always able to see that, especially if they've had a hard time maintaining a job or maintaining a healthy relationship or, you know, things like that.
I agree with you, Natasha. The one thing though, and I wonder if anybody sees this with narcissistic personality disorder, so often they come in session, but they don't really believe they need the session. They believe that somebody else, you know, they're there for another reason, and it's the person's fault that they're their partner. Huge attachments and huge trauma issues. But I see quite often that they don't see themselves as the problem. And if you're not real careful and you're not real familiar with NPD, you can be manipulated to believe that, you know, everything is not what it seems. I don't know if anybody else has had that experience.
And I feel like that a lot of the access to personality disorders are learned behaviors that help them cope with traumas. And that's often how they develop, is ways to deal with the traumas that they've gone through.
Susan, do you mind sharing who the specialist is with the Masterson's approach?
Yeah, the specialist is Carol Keeler in Winter Park. She's a little older. She just got a small private practice, works part-time. She's excellent though. And I was doing consulting with her for probably a year to a year and a half, and then COVID hit and kind of that backslided. But I've consulted a lot with her, and then I've read quite a few of the books too. So I'm also happy to consult as well on that approach.
Very cool. Lisa had mentioned narcissistic personality disorder. Anybody have any thoughts on working with someone who is showing signs of narcissism and kind of avoiding getting into that conflict with, because that's very easy to do.
Can I just add something about what we had just discussed before we?
Sure.
I think we're talking about destigmatizing, like as clinicians. I think that's what we're talking about. And, but I just also think, because I've worked on treatment teams, like with psychiatrists and peer counselors and, you know, different treatment providers. I've worked in like settings, team settings. And I think agencies also need to take more initiative in training their staff, because I used to work at Aspire also, and I had so much contact with different people that were working with clients. And there was so much stigma, like from the psychiatrist, you know, and treatment team to the, like the people at the top basically are not destigmatizing. So I'm glad that I can work on that. But if I'm one person and there's all these people who don't have proper training, even to the, I mean, if I were to confront stigma in my old office, even peers would say, but I'm not offended by it. And it's like, okay, you're not offended by stigmatizing language. That doesn't mean that it's not harming our clients. Like, so I think there's also a cultural problem too. And I'm not saying that we can necessarily, you know, individually, of course we can do things, like we can try to hold higher level and agencies accountable. I just think there's a training that's needed overall in a lot of our settings.
Absolutely. I concur.
Yeah, I agree 100%.
I can speak to the narcissism question if you want, Wendy.
Yeah, go ahead. Yeah, please.
My approach is to never lose empathy with them, and to really see past the defenses and recognize they're actually deeply struggling with feelings of inferiority and insecurity, and to get them connected with that. So I more or less push really hard and focus on the underlying feelings of that, and continue to just kind of push through the defenses and point out their defenses to them. That's my main approach with them.
Is there anything you're using, Susan, in your practice to do that, like a exercise, or are you just kind of expressing what you're seeing them show you in your session?
I'm expressing what I see them showing me in the session, and I'll basically say, you know, I think that's probably a defense that's been built up to protect you from feeling so vulnerable. And I just continue to show empathy and compassion and try to create a safe space where they can actually get in touch with those feelings of inferiority and insecurity and process them. The defenses are usually strong, of course. I mean, the more of a personality, you know, the more severe of a personality disorder they have, the harder that work is. You have to be awfully patient. You know, most of my clients that I have treated with personality disorders, I usually don't really get a breakthrough until probably like 3 years in.
Wow.
It's a lot of rapport building and, you know, skill building and stuff like that. But if they stick around long enough, eventually they kind of have this like aha moment where they kind of see it all in play at once. And then there's a real good shift into helping them really let go of their defenses and begin to express their more authentic and their more real self.
Interesting.
Really interesting. It's kind of refreshing too, because I've heard so many times that you can't cure or change someone who has a narcissistic personality. So I'm really intrigued by the work that you're doing and the success that you're getting. That's cool.
I think Ritu asked a question in the chat, how clients react to me pointing out their defenses. If I'm interpreting the attachment issue correctly, it works really well because it resonates with them and it makes sense to them and they feel seen and heard. The only time that that's actually more difficult is with someone who's presenting with a more schizoid attachment, because anybody who gets too close to them, it makes them deeply uncomfortable and they want you to back off. So with them, I have to be a little bit more careful and not interpret the defense to them in an absolute way. I have to kind of take that backdoor approach of like, you know, like I'm kind of thinking that maybe this might be happening, but maybe it's not. And it just, you know, what do you think? Or we don't have to talk about it if you don't want to. I really give them a lot of outs because the more direct and sort of in their face you are, the more likely they are to engage in their defenses to kind of get you to back off, because they're very uncomfortable with people getting close to them because the attachment trauma is from appropriation. Somebody in their life appropriated them and treated them basically like an object. And so they're deeply fearful of someone getting too close.
Susan, I know you said you work for Agape, but do you also have a private practice? And if you do, could you put it in the notes?
I am the CEO and founder of Agape, and I do still do certain cases. I don't have anything on the side that officially, but I do, if anybody needs consultation on clinical skill development or professional development or even nonprofit business development, I will do that on the side. And I can put my info in the chat.
Okay, thank you.
Wendy, do you have any other questions?
I do. Sorry, my internet's a little unstable here, so I'm coming in and out. But so when you're working with family members of someone who's diagnosed with a personality disorder, anything that you've seen that really works or has helped family members cope with dealing with the person who's having the issues? It's mostly maybe narcissism or some of those strong borderline or cluster C personality type.
I have a book called Disarming the Narcissist. I haven't read it, but I own it. It's supposed to be good.
It's funny. It's a good book.
Who said that?
I did. And this is Lisa. It's funny. It's like, I have it, but I haven't read it, but it is a really good book. So,
I think I read 2 pages. I was like, oh no.
well, and with NPD, the family dynamics most times is so overly enmeshed, and there's such a protection factor that even if, for instance, the mother is a narcissistic mother raising the children and dividing the children, and who's the, they each have their own role of who's the favorite child, who's the scapegoat, who, it's quite interesting because the children grow up to be adults still, generally speaking, not all the time, but very protective of that family unit and the mother in particular, even though the mother treated them perhaps as an object, or they were the favorite one that got all the attention and may have replaced the father in some kind of roles, not necessarily sexual, but some kind of intimacy roles, if you will. So the dynamics of the family is you really, really have to have a strong understanding of that family, because you can wound and lose them as clients and patients real quick if you don't understand the dynamic and work within the network. And Susan brought out some really good points about, you have to have the patience, you have to have the compassion and the empathy. I typically, in my history personally and working in the field, I don't see a lot of narcissistic true NPDs that will stay in treatment for 3 years. If they are true NPDs and you get too close, whether it's too fast or the slow boat, it is more than what I want to say what they can handle, but the trauma is so severe, and so often we forget this is ingrained in their development. So ingrained in their development, meaning this is how they respond to the world, how they view the world through their lens. And if you're not viewing that world through their lens, you as a clinician, or myself as a clinician, or anybody in the world can criticize them in something that we would not see as criticism. And you know how everybody who, I won't say everybody, but when we personally get criticized, we go, oh, yeah, well, they go, oh, and they're out in most cases. So knowing the family dynamic and having a real big understanding of, and not generalizing all, because all is not the same. And there's so many different kinds that there could be a covert narcissist versus an overt narcissist. There's different stages and or categories, if you will. I mean, I don't mean to depersonalize it, but there really are. So yeah, I hope that makes sense and helps a little bit. And I'd like to hear other experiences. Oh yeah, and Wendy,
Thanks for sharing, Lisa.
Wendy, are you okay?
Me?
Yeah.
Oh yeah, I'm having a bit of an allergy attack this morning.
Okay.
My eyes a lot.
No, I noticed you, and I'm like, okay.
Yeah, sorry.
Okay, no worries.
Really bad. Thanks for checking in. Anyone else experiencing, as Lisa was talking about, some of the different things that she discussed or different approaches?
One of my clients, her mom has been diagnosed with borderline personality disorder, and she swears by, I think it's like stop walking on eggshells or walking on eggshells or something like that. And then she like swears by it. I haven't read it myself, full disclosure.
Another good book.
But yeah, it really, really helped her be able to process a lot. And then I guess there's also a Reddit thread of like, it's something like, you know, were you raised by a borderline parent, or like being raised by a borderline parent? And she's also found a great, when she found these on her own, but that's been a really great support for her as well, to just feel validated in the things that she experienced.
Oh, thanks for the resources. That's awesome. All right, guys. Well, I appreciate you all being here and all of your insights. It's been really interesting to hear all of the different thoughts on personalities and how we're treating them. Appreciate you being here today. I hope you all have a wonderful day today. And if you have any suggestions or ideas for future coffee and conversations, something you want to delve into, please let me or Sarah know. We're always open to new ideas. And other than that, have a beautiful day, and we will see you in 2 weeks.
Thanks, Wendy and Sarah. Bye.
Thank you.
Bye,
Everybody, it was good
so
seeing
much.
you all.
Bye.
Bye.